Okay, the live stream's up and running.
Okay, everyone, we have 10:30. I'll call the meeting of the neighbors of Dunn County to order. We'll have roll call. Mike Kinnear, are you there?
I'm still here.
Kelly McCulloch,
Yep.
Sarah Kennedy. Yeah, I didn't think she was there yet. Steve Jensen. Steve? No. And then Chair Dave Bartlett, I see you're also with us, so.
Yes.
Okay. I have to apologize. I have one computer that's down, so I'm trying to work with my cell phone as far as my agenda, and it's awful small, so if I look squinty, that's why. We'll have I'm sure everyone had a chance to look at the minutes. Is there a motion to approve?
So moved.
Second? We do have a second?
I'll second, yeah.
Okay, thanks, Mike. Are there any other questions on the minutes? In hearing none, all those in favor say aye of accepting them.
Aye.
Aye.
Opposed? Carried. Okay, public comment, I know of none. Anyone else? Okay. We'll get into Carmen's administrator report, please.
All right. As always, we start with Quality Assurance Steering Committee updates. We actually did not host our QA meeting as scheduled this month due to having several of the individuals that are on this committee out on the day it was supposed to be held, so it was postponed. But we will be holding that. But we do go over quality assurance updates on a daily basis during our morning meeting, which is an extension of our QA meetings. But we have not had any reportables or any issues like that. We have not had any surveys or anything like that as well. So I will give an update probably on 2 separate meetings on next month's report. Any questions about that at all? Okay. And next is the employment activity report, which would be Chris.
Can everybody hear me?
Mm-hmm.
Yes.
Okay. Okay, so the employment activity report, it looks a little bit different this month because I was partially working from home. So I was kind of doing it kind of piecemeal, throwing it together. So if I omitted anything, I apologize in advance. But so for the month of October, we had 9 interviews scheduled. We did hold 9 interviews. We offered 9 positions. The number of positions accepted were 8, and none were offered at higher than a step 3 because we didn't basically have any nurses starting. We had some resignations during the month of October. So we would have had one part-time CNA that left. She resigned during orientation. We had a full-time RN that had left, basically stress issues, personal issues. We had a full-time CNA who was called back to a different country for family emergency issues, and I've been unable to contact her since to get a plan going forward. So she's just basically resigned. We had a full-time employee resigned during orientation. She didn't want to leave her other job. And then we had 2 part-time homemakers that had just stopped showing up and didn't return contact at all, with numerous attempts at contacting them and nothing. So you can go down and look at the open positions. We low on agency nurses as we're sitting there, pretty hard to get, as well as some of the pool CNAs are a little hard to come by. So we did have, some people hired and then some people left, so it almost kind of like canceled itself out. Then our number of leaves are down there. We do have a number of part-time CNAs that are out on educational leaves. Hopefully, last time around when the schools went virtual, some of those people did start picking up a little bit more because their class schedule opened up a little bit, or they were doing the school online. So kind of keeping my fingers crossed for that. Not that the school's closed, but that they will pick up a little bit more. It was a good month for work comp. We didn't have any lost time accidents in October. Number of missed shifts, I did put this kind of in italics at the bottom. Number of missed shifts, and Carmen can probably jump in and talk about this a little bit too. For October, we had 90 missed shifts due to COVID issues, whether it be a COVID positive or COVID exposure, or how, Carmen can speak a little bit to that process of how long somebody would need to be off for that. In November, it's not looking better. So in November, we also received 6 resignations, and I don't really have any applications to go forward on. Do you have any questions or comments? If Carmen wants to talk about how that works, how long somebody has to stay out due to an exposure or something, she can repeat that much more efficiently than what I can.
Mike, you have a question?
Yeah, I just want to thank you, Mr. Chair. I just want to make sure I understand. In the open positions, we have 5.8 full-time equivalent open positions for an RN, and only one of them is filled, so we're almost 5 full-time RNs short. Is that correct?
Correct.
Okay, thank you. And is that filled then with lots of overtime?
Overtime, our staff does utilize the incentive for picking up the vacant hours. Or LPNs will fill in sometimes for the RN, vice versa. But yeah, they are vacant as of right now.
Can I speak for a minute? This is Paula.
Sure.
So like Chris had said, we are filling a lot of the positions when people are picking up for incentive pay. However, it's the management staff is also working as of right now. I'll be working this weekend night shift because we don't have anybody unless we get somebody to pick that up. The management staff has been picking up extra shifts as well.
Thank you very much.
And then if it's okay, Chairman Johnson, I can explain what Chris was talking about as well.
Absolutely.
Okay, so those 90 shifts, and that was, as Chris said, that was for October. November has seen an increase of that as well. I would assume that by the end of November, we'll have much more than 90 shifts in the month of November. But what that means is anytime that anyone has to be off of work because of COVID, whether it's an exposure or if it's because they have COVID, if they're showing symptoms and waiting for test results, anytime that we say you cannot work because of something COVID related. So if it is an exposure to someone, say their spouse or a child, or even just out in the community that they know they had exposure to someone, they're out for 14 days at a minimum based on their last contact of that person. If it's a child that they cannot separate from, their 14 days starts once that child recovers. So then that can be up to 24, if not longer. So that's a really long time frame that people are out. And then if they are having a symptom, any sort of symptom that could be COVID, so it could be a headache, all the way to the severe symptoms or digestional issues, throwing up, fever, obviously, cough, runny nose, anything that could be considered a COVID symptom, we require them to get COVID tested and be off of work pending the test. So even if they don't have it or an exposure, that's missed days. And then if people do have COVID, they're obviously off while they recover. So, and that's normally 10 days. So we're seeing lots of people that are off for extended periods of time and having even more of a hard time filling those shifts. As you can see, we're already short-staffed prior to it. And then when we have a bunch of people that can't work due to COVID, adds added stress to that as well. Any questions on that? Okay. All right, and then I guess we will move on to the resident referral report. This is also looks a little bit different because we have had very few admissions due to COVID as well. So October was not nearly as bad as November is going to look. We started the month with 111 residents in the facility, which we ended with 114. So we did have an increase in October, but we will not in November. We had 41 referrals, 15 of which were admitted. 10 of those we could not accept due to COVID. So because we have an outbreak, we cannot accept when we are doing outbreak testing. So it's 14 days without a new positive. And currently all 3 of our facilities are in an outbreak of some sort. So for quite an extended period of time, we were not able to admit anywhere. Before we were kind of picking and choosing and admitting to the building that could be admitted to. And at this point, for quite some time, we've not been able to at all. So there's quite a few that we have not admitted. We had 2 people that were COVID positive and we had not had any residents yet. And they had they couldn't be admitted anyways because we couldn't accept. We had 3 that went to first choice, 2 of them being facilities closer to home and 1 going to swing bed. We had 1 that was out of network with insurance, 3 that were severe behavioral issues, 2 that passed away at the hospital, and 5 that went home. We had 7 deaths this month, none of them COVID related, and we had 5 discharges home with the ending census of 114 at the end of October, which as you all know is well below our goal for budgeted as well as our normal, and primarily due to not being able to accept admissions. Our outer 2 buildings have stayed full or nearly full this entire time. It has been Central that has had the majority of the issues staying full due to that's where it's about admissions in Central. The outer buildings, they obviously people pass away and things like that. And then we have room for admissions, but the main business in the Central building is the in and out. And right now that is being compromised because of COVID. Any questions for me on that? Okay, and next is environmental. So I will have Scott address that.
All right, good morning, everyone.
Morning, Scott.
I guess the main thing, what's been going on the last month is probably washers, dryers, dishwashers, TVs. It's a big thing that we have had issues with. The guys have been staying on top of it very well, repairing everything as needed, putting some parts into things. TVs, obviously, we're not be able to repair. Some of the TVs that were originally placed in the building when it was open are starting to go out, running into a situation there. As far as dishwashers, that's a common thing with all the heat and that. Parts have been deteriorating, so they have been putting parts in them, getting them back up and running. Washers and dryers, they've been repairing those as necessary or as they can. We've replaced a few, but the situation with the residential style washers and dryers in there, they take a lot of use. Other than that, the guys have been keeping up with everything that has been needed for COVID related, working closely with Carmen and nursing staff on that. We keeping up with the cleaning with the custodians. We had a new custodian start today through Express. Since we moved Bob out of the neighbors as a custodian over to facility worker here in CSB. We've gone through a few custodians, haven't really worked out. So we've got a new one that started today with Express. Have a good feeling she's gonna work out well. So wish us luck on that one. Otherwise, business as usual. Any questions?
Brian, you were muted.
It wasn't worth saying again, Carmen, so. I just said he isn't plowing snow today.
No snow.
Thanks, Scott.
Thanks.
All right, next on the agenda is COVID. We have a lot to go over with this. We have had changes in the last month. So the biggest one, as you're all aware from Paul's emails, we have had our first resident cases. We currently have 4 residents who have tested positive, all in the East building. So we have maintained on keeping it just in one building at this point. And since all 4 of them were identified within 2 days, and we have not since identified any others or had any other spread that we know of. So we're hoping to keep it that way. That building is on complete lockdown, for lack of a better term. We are doing our best to not share staff across buildings, which has been the goal all along. Unfortunately, it's very difficult with the amount of short-staffed that we are. So we are doing our best to keep everybody over there, bring them the things they need instead of having their people come pick up things from our central building, which is house to central supply. It's where we have the testing stuff, all of that. So working on keeping them over there as much as possible and not infecting other buildings and other people. So all 4 of the residents so far are doing okay. And we have them on complete isolation, as well as the building is under general isolation as well. Before I move on, does anyone have any questions on the resident related situation? Okay. In addition to the residents, so far since the beginning of the pandemic, we have had 16 staff members test positive, and that number keeps going up and up at a steady pace. Up until about 2 weeks ago, we were under 10. So a week and a half probably, we were under 10, and now we're seeing 3 or 4 a week. So we are seeing a steady increase, just like the rest of the community and the public is seeing, but it holds a little bit extra weight here with the risk of spreading to the vulnerable adults as well as the other staff members here, and it is adding to our staffing crisis as well, which is very difficult. This is what's causing those 90 shifts to be unfilled, and working through that as well. Oops. Sorry, my light is on a timer. So we are seeing a steady increase as, like I said, with staff. We're trying to avoid any sort of contamination or infection between staff to staff here, tightening down on things that we've been doing all along, but making sure that they're as strict as we can be of break room etiquette and eating lunch, stuff like that, smoking in cars, things like that, making sure people aren't doing that together. Anything that we can potentially limit the risk from spread from staff to staff, to also help with the staffing crisis. And then of course, the risk of spreading from staff to residents as well. Due to our 4 residents testing positive, we do expect to have surveyors in our building to do an infection control focus survey in the next couple of weeks. Originally, I had anticipated them here within 3 to 5 days, but when I spoke to their supervisor, they said that that's not realistic of what is actually happening. So sometime in the next couple of weeks, they should be here for the East building to survey specifically about infection control, see how we're doing now, see if there was any error that we did in previous to this residents testing positive, kind of just double checking everything and then making sure we're handling the outbreak appropriately. So we will see them shortly. We are still testing all staff twice a week. Mondays and Thursdays, all staff are tested through our state lab. We are doing that in accordance to the CMS rule of 10% case positivity rate in the county or higher requires that amount of testing. And we have been at that rate since the beginning of October. So two months now almost that we have been testing twice a week, which is another staffing issue as well of staff to do that. It takes 2 staff members to facilitate the testing and the paperwork side of that as well for a whole day on those 2 days. We are also testing all of our residents weekly. Right now they're getting tested every Tuesday. Because all 3 buildings have been in an outbreak that is required until there's 14 days of no new positives. At this point, we're just continually testing all of the residents weekly. Better safe than sorry. And right now, all 3 are in an outbreak. So we do require to do that. Any questions about any of that?
Mr. Chairman,
Yes,
may I ask a question related to staffing?
absolutely.
At the risk, Carmen, of sounding alarmist, what do we do or what have other facilities done if we simply cannot find enough staff to provide the necessary skilled nursing service for our residents? What is our answer?
So we do have a contingency staffing plan, which we have enacted some of that. The first one of the steps that Paula mentioned is having staff that typically do other things like our managerial nurses working the floor. Obviously, they can't work every shift, but that is part of that plan. Having staff that are previously trained. There are 9 of us that have been CNAs to use emergency CNA protocols that the state and the federal government have issued to allow people that are not still certified to use an expired certification. I believe we have 9 people on staff that were CNAs at one point that no longer hold a CNA license. That is a step to it. Using as much agency as we can get. They are also short-staffed. They also have issues with COVID positive buildings pay more money to the agencies. So they have hazard pay related billing for the agencies. So since we hadn't had COVID in our buildings, we were having a hard time finding CNAs because they would rather go to a building with COVID and make more money. So that was an issue with that as well. So finding CNAs through agencies and enacting working things like switching to all 12-hour shifts instead of 8-hour shifts eases some staffing, which a lot of our households are already doing that. And then there's also relief staffing through the state that other facilities have tried. To my knowledge, it has not worked well. It was on a call a couple weeks ago and everyone said they attempted to do so and it didn't work. So we do our best staffing, trying to think of ideas to limit amount of staff needed. We had, and this is another item that's not specifically on the agenda, but related to COVID. Currently, we do not have any residents in Arrowhead as a staffing concern. We did have natural attrition of them discharging, but we purposely were not admitting, even though we can't admit right now, to Central to Arrowhead to alleviate the staffing issues, and then having all of the short-term rehab on Fireside, because then that doesn't have a staff member down there and it requires one less person. So different ideas to try to limit the amount needed as well.
So if I may follow up, Mr. Chair.
Yes.
So in the central business building is where we take in the short term, the rehab. We've not had that happening, have we? Is that one of the things we've had to curtail?
Correct. We will be able to accept in Central starting tomorrow if we get all of our results back from Monday's testing or come back negative. It'll have been 14 days with 2 rounds of testing for residents in the Central building, so we would be able to, but because of our outbreak situation, we haven't been able to accept for quite some time. And that's why our census has dropped, but it has helped staffing a little bit because we need less staff because of the census dropping.
Exactly. And I guess that's part of what I was wondering about, is whether or not, even if we were able to accept the shorter term rehab type residents, if we literally can do so because of our short staffing. It's very much a catch-22. We need residents for income and for viability of the operation. But as our staffing becomes more of a crisis, there's less of a service we can provide. Are we considering, even though we may be eligible to accept rehab type residents, that we're not doing so because we do not have the staffing, or we need to divert that staffing to the long-term care?
At this point, we have it only accepted to the level that we're currently staffed at, and that's what we will do. So we won't have anyone in Arrowhead at this point because that would require an additional staff person to be down there. We'll only accept up to the level that we currently have staff at in Fireside. So we're not to that point yet. So we could accept a couple people, but every time we have a referral, our social services team that does the admissions talks to both Paula and myself to go over if we can accept them. Also based on the acuity of the person, if it is someone who is maybe a 1 assist that's fairly competent, able to make their needs known, isn't going to have extra additional staff time besides just the regular things, that's an easier admission as well. So we also look at the acuity of the person and compare that to staffing too, to see if someone's going to be a 2 assist that needs total care with everything. That takes up a lot more staff time than a simple orthopedic surgery 1 assist person. So
the nightmare scenario, and I hope we don't get there, is we have the natural attrition through resident discharge or death, accompanied by the steady attrition in staffing due to COVID-19 that if the trend doesn't turn around, could severely diminish our population and our operations. Hopefully not to the point where it's simply unsustainable, but that is a danger that we face. Yes?
yes, it
Or is
is.
that overstating it?
No, I don't believe that's overstating it. I think that is very true, especially in our Central building. And just as a caveat, it is true across the industry in general.
Right.
We've been talking to other nursing homes, both on the DON weekly call as well as the DQA call. Everybody's in this boat right now. No one can accept admissions. That's been causing a huge burden on the hospitals as well. That rule is not just for us, so it's for everybody. And we're actually fortunate to have the 3 separate buildings that sometimes we can't admit to one. If they were all connected, we'd have a bigger issue for admissions as well. So I know they're sending people all across the state. They're not being able to go to a facility that's near them. They're basically trying to find the first one that's not in an outbreak, and that's where they go. Otherwise, they don't have a place to go anyways. So we're having a lot of issues with that as well with the hospital system of they have too many people. They're looking for places for people to go and no one can accept.
So, and Mr. Chair, I apologize if it feels like I'm monopolizing, but I think it's important for the committee awareness of the consequences of COVID on the neighbors of Dunn County. We've talked before in the past, pre-pandemic, about the regulatory difficulties of moving residents from one neighborhood to another. Has there been any relaxation, even temporary, in response to this pandemic? And what I'm thinking ahead to is, depending on volume, do we have even the option of considering consolidating remaining residents into out of one neighborhood rather, so that we keep two of the neighborhoods more full, can consolidate staffing there and maybe empty Central or whatever? Or is that not even a possibility?
At this point, I think that's a little bit premature. The outer two
Okay.
buildings are both very full still. I believe, look at my notes from this morning. East has one opening and West has three. So they're still very full. We would consider doing that if we got to that point. The only big concern with that is, like, if we're in this situation right now, East has an outbreak. It would not be ethical to move residents into an outbreak, as well as that admission hold also affects those buildings from us. So because of our licensure, we cannot move people right now because that's considered an admission, because we are separate.
So what about internal within the neighborhoods themselves, consolidating within houses?
Yes, we can do that, and that is what we did with Fireside and Arrowhead. So we can consolidate within one internal building, but moving building to building is considered a full discharge and admission. So if any of the buildings are in an outbreak, we can't move them. And if, say, Central was in an outbreak and East wasn't, East could accept an admission, but Central, we couldn't discharge that person to another nursing home because we wouldn't take someone from another nursing home that was in a COVID positive nursing home. So it's kind of hard to think of it this way, but all three are completely separate. It'd be no different than accepting someone from a separate nursing home outside of our company. So it's a little bit confusing, but we could do that if all three were out of an outbreak. That would be feasible, or if the receiving and accepting building were out of an outbreak. But either way, if either one was in an outbreak, we couldn't do that.
So I appreciate that, Carmen, and I just wanted to give the committee some sense of the complexity of the issue and possible consequences of this ongoing pandemic. So,
yeah.
Thank you.
And unfortunately, I do not foresee us being out of outbreaks anytime soon. Like I said, Central is close to it, but all it takes is another staff member that's Central staff to become positive, and then we're right back into that, starting over at 14 days. So it's very unlikely with how things are going that we will be out of an outbreak for any length of time. Any questions for me on what we've gone over so far? Okay. The only other thing I wanted to touch base on a little bit with COVID was vaccines. So there has been movement in vaccines. I know it's been on the news, as well as I'm sure talked about in some other committee meetings. We have gotten word about vaccines. There's now 3, I believe, that are showing high levels of effectiveness. And we are working with public health as well as the state on how and when that vaccine will become available and how we will distribute it and get our people vaccinated as soon as possible. At this point, the plan that has been discussed on a couple of different webinars through the state for vaccinations it's looking like early next year for the first round, which all healthcare individuals are included in. All healthcare individuals are included in the first round. So healthcare personnel, direct care workers would be the first people to receive vaccines, which would include our staff. Residents are in the second phase of vaccination in the state's plan, or the state and the CDC's plan. So we'd be looking at later in the beginning of next year for our residents as well. So we're following this and working with KT on the best plan for distribution, as well as our local HERC coalition, which is the Healthcare Emergency Planning Coalition, on how to do this as well. One of the vaccines is distributed in groups of 975 vials. We don't have that many people. So it's also working with other organizations to see the best way so that A, things aren't wasted, and B, that everyone in our region that needs to be vaccinated gets in that first round to protect our residents.
Well, that's good news, Carmen. I didn't realize it was going to be quite that early. I understood it'd be the second quarter of the year, but.
Yeah, so that's best case scenario. That was on a webinar I listened to last week with the state. That's their goal for healthcare personnel.
Okay.
For the general public, I do believe it's going to be quite significantly later than that. But
Okay. All right. Thanks.
Supervisor McCullough, did you have a question for me?
I just wanted to, Pfizer announced yesterday that they had finished phase 3 and they're hoping to get their first round of vaccinations out by the end of December, actually.
Really? That's good. Good. Mike?
I just have a question. I assume that all staff will be required to take it and that the residents still have the option of taking it. Is that correct?
So I do not know legally, as well as through the state and CMS, what will come out of that. If they haven't come up with regulations for us on that. If it is in relation to like the flu shot, we cannot require staff to get a flu vaccine. We do offer it here. And then if they do not get the flu vaccine, they are required to wear a mask at all times during flu season. So I don't know what the requirements will be for this, if it's going to be different or if it's going to be similar to the flu situation. So we'll wait to find out about that through CMS as well as the CDC, I would imagine, would come out with rules on that for us.
Thank you.
Mm-hmm. Any other questions on COVID for me?
Yes, I have a question. The 4 residents that are infected now, were they infected when they come or how did they get infected?
So one of the 4 residents was a new admission. Whenever we have new admissions, they are on a 14-day isolation. Once they come to us, they are treated as if they could be COVID positive because until 14 days after their admission, they could be without us knowing. So one of the 4 was. The other 3 were not. They were all in the facility. We have not fully been able to determine how each of them were infected. We are still working on that. It could have been any contact with another infected person for 14 days. The individual who was a new admission was not in contact with any of them, so we do not believe it spread from that individual to the other 3 as that person was isolated to their room. So most likely staff contact. The individuals hadn't left the facility at any point.
Okay, thank you.
Mm-hmm. Any other questions for me at all? Okay, we'll move on. The next thing is census and Casemix. I've gone over this a little bit already. As you all know, our census is significantly down, which is unfortunate. But right now, with staffing as well as obviously the COVID admission restrictions, we are well below budgeted census. Today we are at 110. As I said, the outer 2 buildings are full or close to full. It is primarily central. And with the closure of Arrowhead again, we are at a lower census. The closure of Arrowhead was officially happened about a week and a half ago. We had our last resident discharged from there, and it made sense to keep it closed staffing wise, as well as just the cost of staffing. For those of you who are with our committee, when we opened Arrowhead 2 years ago, we took about 7 admissions in the course of 2 days to just make it worth the amount of money it costs to staff the household. So once you get below that point, it's not worth the money that's costing to staff the household to keep it open. So closing it down and having the couple of residents that were down there had discharged within the same week was financially the best option, as well as staffing wise. It did open up a staffing position as well.
Okay.
All right, and then the last thing on my part of the agenda was a little bit of good news since everything seems to be doom and gloom lately. Our 5-star ratings for the quarter came out, and all 3 facilities are still have 5 stars. So that is great news. And then we also got our annual U.S. News and World Reports back, which is a non-solicited, I guess, report on the top nursing homes in the country. And all 3 of our facilities were listed as top performers, so the highest ranking that you can have on that report. So a little bit of good news on ratings and different PR related things as well. So all 3 buildings are doing well in that matter. The interesting thing is with the 5-star rating is there's not much changes lately because there's not surveys. Surveys are what guides those to start with. And we are currently, all 3 of our facilities, well overdue for our annual survey for each of them, which we do not expect to see for quite some time, most likely not until after COVID. So they are not doing annual surveys, but still great news for all 3 to have 5 stars, as well as the top rating for the U.S. World Report.
It's very nice. Congrats to you and your employees.
Thank you. Does anyone have any other questions for me at all?
If not, we'll go into, we will review the vouchers, or we should have reviewed them prior to. Is there any questions on the vouchers? And hearing none, we'll go into the financial report. Is Jane with us?
I am.
There you are. Hi.
Okay. Hello. Okay, so Carmen went over the census and Casemix a little bit. We're high on the Medicaid side and lower on the Medicare A's, lower on the private pays. So that does affect our revenues. But the census on East and West, like Carmen said, is pretty stable right now. So they're holding their own financially. Let's go to the pool staff report. October on that shows 119,000 spent on pool staff. Higher than last month, but last month was unusually low. And a lot of this has to do with timing of the vouchers when they come in. So when October ends, we still are paying October vouchers in November. I would expect December to have a higher amount as we do the catch up for the year end. But it seems pretty much in line. There's no outliers there. Any questions on the pool staff? Okay. Accounts receivable aging report. We have again made progress, I'm happy to say. Year to year, we've like last September when it was starting to climb. Now we're down even below that. So at 1,279,000, I think when I started in April and May, it was $1 million more than that. So we brought it down by $1 million, aging. It continues to improve. The 69% in the current to 60 days is what I look at, that it's weighted. The current billing should be most of the aging, and it is. The older 181 to 365 days didn't move much. We've got the low-hanging fruit there and are working on the tougher claims. Some are having different collections issues and methods. So we're still working on those, not giving up. Any questions on the aging? Okay. And then to the financial statement. The average daily census is a little bit lower than we wanted, but it's hanging in there as a campus. If we go down to the revenues received on the actual year-to-date, kind of center of the first page there, we've gotten COVID payments of over $1 million. There's 4 to 5 different grants and different terms and conditions of each of those that we are trying to meet. And we found out yesterday that lost revenues will be included in our capacity to claim. So that was good news. We're hoping to claim all of, expenses against all of the million, but we'll work towards that. Some of the expenses that we see are embedded as COVID expenses. We can take out the COVID revenue, but not the expenses because it's embedded into each department. So some of those will be pulled out as we claim them. Pool staff is showing up, as an expense within there that is high. Any questions on the financial statement? Okay.
Mr. Chair, could I add something just real quick? Okay, thank you. Jane has really done a really good job staying on top of these ever-changing rules or lack of guidance on these COVID grants. And I will tell you that it still will be a continuum that will actually go into 2021. Another item that Jane learned yesterday on the National Leading Age Call was that this actually goes beyond 2020 and into 2021. We also, the eligibility to use these funds that we've received to date, which really is one of our primary focuses on the financial side, is doing everything we can to keep these funds. Certainly it helps our bottom line at the end of the day. Also pursuing additional potential grant applications that come up. So we're aggressively monitoring that and trying to stay on top of that. There will be other challenges with this. The financial reporting, auditing, how this impacts our cost allocation, funding coming back from the state of Wisconsin, a lot of unknown questions. So there's probably going to be a lot more to report out in the future, working with our auditors, working with our state and national associations. So I just wanted to make the committee aware that this is kind of we're standing on quicksand, kind of shifting around here, trying to keep up with it.
Thanks, Keith.
There's one more item I'd like to bring up. Our staffing, we have one retirement of Kathy Gilgenbach, who's been with the county for 21 years. Today is her last day, and wish her well. We've been able to, within the funding, we reviewed the budget and are able to hire a short-term LTE to cover the gap of billing and getting the bills out and following up on claims until a new person is hired. That won't cost us anything extra. So I'm happy to say that person is starting today as well. There'll be about a 2-hour overlap if they need to do any extra training. The person is gifted in our software and the Medicare skilled nursing billing. So it was a very lucky fit.
It's a plus.
Yep. So I don't see our aging being affected greatly by the staffing change. We'll all have to carry a little bit heavier load, but we'll get through it. I am confident that there won't be a huge difference in our aging trajectory.
And if I could add to that real briefly, this has been a point of emphasis of ours since last fall. And since we've experienced the turnover and transitions, emphasizing cross-training, We did increase staffing hours earlier this year when we filled the other one of the vacant positions. Jane has put a lot of focus on that, working with her team. So we're seeing some benefits of the results there. Plus Jane's experience and connections, being able to bring in this LT that's pretty much ready to jump right on the job on a very limited basis, but still it helps us cast a wider net of support to avoid the situation we've been in previously.
Very good. Jane, do you have anything else to add?
I don't. I'm out of good news. Except that the
Okay.
leading age call was very beneficial. It was with our association connected with our national policy branch of leading age, and we got some great clarification on some topics that we needed for the provider relief funds.
Very good. Very good. Is there any questions for Jane? And hearing none, is there a motion to approve the vouchers and the financial report? I
So
see
moved.
Mike. I don't,
Second,
we have a motion and a second to accept. Any other questions at all? Hearing none, all those in favor say aye.
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 Opposed? Carried. Anybody have anything else? We're close to adjournment. Guess not. All right, we'll see you all next month, maybe some of you before. Have a good day. We are adjourned.
See y'all.
Bye, all.
Hey, Carmen, can you
Yes,
switch me as host? I dropped out.
Have a
My
good
connection
holidays.
ended.
Yes, you too.